I'm Julie Latchem Hastings. I'm the study manager for the LEAP MS project, which stands for Lifestyle, Exercise and Activity Package for people with progressive multiple sclerosis. The LEAP MS project is a 3-year funded project by the MS Society UK. The project is basically looking to support people with progressive MS to be as active as they possibly can be. The study is broken down into three sections, 3 stages. Stage 1 is trying to understand the facilitators and barriers that people with progressive MS have to being active. We are to discover and understand this better. We are interviewing people with progressive MS and physiotherapists and other healthcare professionals who work with people with MS. In the second stage of the project, we are coming together in a co-production event or series of events to bring people together to discuss the key issues of the project and try and work out what would be most helpful, what type of interventional resource could we provide, could we build to be helpful. Once we have finished our co-production strand, we will then move on to build whatever the co-production event suggests would be helpful, and in our final stage, in the third stage, we will then test whatever it is we have built to find out, is it acceptable to people, do people like it, and is it feasible to run as a future random controlled trial.
It's very hard to be physically active with MS, and as MS goes on, it gets worse, everything gets harder. I've gone from being very physically active to being practically sedentary, and you've just got to accept it, but at the same time you've got to do as much as you possibly can. I'm a great believer in being as active during your daily life as you can be. You've got sort of obvious things like doing an exercise, you get something down from a cupboard and you do a couple of lifts just to get the exercise out of it. It does get harder, but you can always fit in that little bit extra. I think mental attitude is the important thing. It's very easy to sort of sit back and go, oh right, that's it, I'm disabled, somebody else has got to do it. You've got to keep pushing yourself. You've got to believe in, I'll do what I can, and that's an achievement for me. I say to my husband some mornings I want a medal just for getting out of bed and getting dressed. I'm not going to get a medal, but you can sort of pat yourself on the back and feel good about every little achievement. And sometimes those are the important things.
So my name is Kate Button. I'm a physiotherapist. I'm also a researcher at Cardiff University. My interests are in how we can use technology to help people treat themselves better at home and how we can make treatments more efficient. I'm here today to help in designing the intervention and looking at what type of website we need to support people with MS with their treatments at home.
There is talk of producing a website in conjunction with the physios. I think particularly after today they're going to make it very easy to tailor it to exactly what you want, because some people need strength building, some people need cardiovascular exercising, some of us just need lesser things, and it's a question of what's suitable for you at the moment. It's fantastic to have a physio there that you can ask for more information. But at the same time, we have to decide for ourselves what we can do and how far we can push ourselves. And the idea of having a website where you can tailor it and say, I can do that exercise, that will become part of my daily programme. I can do that one, but forget those. And being able to tailor to that degree is really valuable.
I'm Fiona. I come from St George's University of London and Kingston University, and I am a physiotherapist and I run a social enterprise called Bridges Self-Management. Bridges Self-Management is about a way that therapists, nurses, doctors work with the patients that they care for, and it's really about a different take on self-management. Sometimes when people hear the word self-management, they think that it's about just being left to get on with it on their own. But what we've developed over the years is a way for people to be able to interact, collaborate, and really understand that person first as a person rather than their condition. So we've developed training and we've developed lots of different tools and resources, but essentially it's developed with people with stroke, with brain injury, with multiple sclerosis, with lots of different conditions, with their ideas, experiences embedded into it. So Bridges have been going for 12 years now, and this is our first time that we've collaborated and worked with Cardiff University to really understand the experiences of people with progressive MS and actually build their ideas and their experiences into our training. So our training will stay in some ways the same, but it will have a flavour and it will be about people with progressive MS. So we need to find out from them what's important, and that's how we'll be shaping our training. And then we'll be delivering training to the therapists who are going to be working with this new intervention.
It isn't entirely leaving us to our own devices. They're looking at ways that we can feed back to a physio and say, I'm doing this exercise, but I don't think I'm doing it right. Or I'm finding that particularly hard. Can I switch to something that will provide the same benefits without being so demanding? And it's all about tailoring and personalising your experience of exercise.
I'm Barbara Stensland and I'm the PPI representative on the LEAP MS study. I chaired the PPI steering group, which meets 2 or 3 times a year to feed back into the main management group of the study. And today I've been helping out at the creative workstation with two artists to find out ways to express other people's feelings about how to cope with MS and physical activity, what the barriers are, and what would facilitate them joining in activities. And it's been a really interesting day. It's been great to see the artistic work. People were a bit nervous to begin with, but they've just poured their heart and souls into these artworks, which are really quite powerful. So it's been fantastic.
I'm Rhiannon O'Halloran. I'm the MS physiotherapist in the area, and I'm part of the study as to be involved in the physical side, in encouraging people to exercise. This study is really important because physiotherapists can't be with everybody all the time and don't need to be with everybody all the time. However, we need to be able to help people to keep as active as they can. So we are looking at that, and today we were trying to explore different activities that people could do and also how they were motivated or maybe not motivated to do those activities. It was really interesting listening to everybody, and we do know it's such a diverse group of people that we're going to have to try and make this really different. It's not an exercise prescription, and I think this is what it's all about. People want to say, how do you do it? What do people with MS, why should they exercise, and what should they do? And there isn't a what should they do, and it needs to come from the person. What do they need and what do they want to do? Do they want to treat their symptoms? Do they want to get more active? Do they just want to feel better about themselves? So it was a brilliant day because we had just heard so many different things come out of that. And hopefully we'll be able to develop something that most people will find useful and just encourage everybody to be that little bit more active.